Morning, everyone. It's truly a privilege to be here among the educators, healthcare professionals, and researchers who share a common vision to make our academic spaces not just centers of learning, but centers of well being. Let me begin with a thought by Sir Albert Einstein. Try not to become a man of success, but rather try to become a man of value. And in today's context, the value lies in empathy, resilience, and mental well being, qualities that education must nurture alongside intellect. Today we'll be discussing under these following headings. Emotional stress and personal mental health is a major barrier among college students' enrollment and retention. The over-reliance on university counseling centers alone fail to address the campus-wide mental health need. So embedding well-being into the classroom, policies, and culture can improve academic success and also the well-being of the individuals. Seeing today's scenario, students' mental health is a public health crisis. Globally, 1 in 7 adolescents experiences mental health conditions such as your anxiety and depression. Whereas in India, 43% of adolescents are affected with mental disorders and they are classified as either of these two conditions. Despite growing awareness, students do not approach for help because of stigma and limited access. A recent article from Indian Express highlights university struggles with an inadequate mental health support due to underfunding and lack of trained professionals and underused services. So there is urgency for a paradigm shift. So we have to change from reactive to proactive. So instead of waiting for a crisis to occur and to give a solution, it's better for us to build resilience and have preventive measures. So mental health is a collective responsibility where everyone should hold a shared responsibility. That is your peers, professors, and administrators. So every classroom policies and interactions can either support or strain the mental well-being of a student. After financial reason, the most prominent reason why a college student, that is why a student does not enroll in college is being your mental health. So we should reimagining support models. So how can we support these students are? Mental health cannot be confined to a single office or counseling centers. So truly supportive university should include all its places like classrooms, the labs, hostel facilities of its mental health ecosystem. So faculty, administrated peers all play a pivotal role because they are the one who identify the mental stress in a student at the earliest stage. Support should be woven into the rhythm of campus life. This means designing class schedules that reduces burnout and promote open discussion on stress, normalizing help seeking. We need to align well with the mental health values into the institutional structures, that is training educators in empathetic teaching, revising policies around attendance and assessment to be humane, and cultivating peer support programs. So there must be a culture that values the well-being, enhances both academic excellences and community well-being. So the teaching is not about just what to think, but how to think and feel. So we can strengthen this mental health just by including lifestyle education modules that would help students to manage emotions, build healthy relationship, make responsible decisions, adapt to changes. And we can practices mindfulness and stress relieving techniques, like including guided breathing, reflective journals, and having a short mental breaks. So we should not have social emotional learning as a separate entity. It has to be integrated along with your life skills and the ongoing disciplinaries. For example, literature classes can explore the empathy, science projects can foster teamwork, and discussion can encourage self-reflection. This helps create emotionally intelligent learners. So basically, teachers and professors are often the first one to notice changes in students' behavior or engagement. So training them to identify early warning signs like withdrawal, sudden drops in their academic performances, or mood changes ensures timely support and referrals. So what could be the future models in schools and university? So it is interdisciplinary courses combining psychology, neuroscience, and life science. So the future of education lies in blending disciplines, courses that combine psychology, neuroscience, and life skills, thereby a student understand the psychology would help how the brain responds to a stress, and neuroscience would teach them how these emotions affect their learning skills, and life skills would enhance their resilience build and to self-regulate them. So this equips them not to just academically, but also emotionally and socially equipped. Students always becomes a peer support before a staff. So always enhancing the students' peer groups and developing mentorship program would help us support them better. So technology can act as a proactive role, thereby helping identifying the early signs from their attendance, performance, or behavioral data, which would help institution to intervene before the crisis has occurred. So there are also apps promoting the mindfulness technique, thereby reducing their stress on a day-to-day life. Rigid academic system often shows unnecessary stress among students. So flexible schedules, extended deadlines, and more holistic assessment like project-based learning or reflective portfolios can support students' mental health while still maintaining their academic performance. So here are a few case studies which would support them. For example, L Science of Well-being has reached millions worldwide, proving that students value emotional resilience and happiness as much as academic success. And majority schools in India and UK has start practicing daily mindfulness session in schools and help students focuses on emotional control and overall classroom well-being. So national initiatives like your WHO guidelines and NEP 2020 of India is the leading in their education policies. So moving on to the challenges and barriers. Despite growing awareness, many students and even educators hesitate to discuss mental health due to fear of judgment and being labeled as weak. So this stigma creates silence and prevents early intervention. Most institutions, especially in developing countries, have limited resource and less trained professional. There are only one professional for thousands of students. And there are budget constraints and lack of specialized training make consistent mental health support difficult. Integrating emotional learning or life skills model often faces resistance from traditional academic structures because they prioritize grading over mental health. So changing mindset within institutions take time. With the rise of digital use, there is always ethical concerns where breaching of data might occur. So moving on to the path forward. Mental health support should be a shared responsibility, integrating across classrooms, student services, and campus activities. When everyone, that is your faculty, administrator, and peers participate, we create a supportive environment that normalizes the well-being. University can adapt clear policies that prioritize mental health, allocate budgets for counselings, life skills program, and faculty training. So thereby leadership commitment ensures sustainability and signals the importance of study well-being. We should engage NGOs, government initiatives, and technology platforms can enhance resources and provide innovative interventions. So interdepartmental collaborations ensure mental health is embedded in every facet of student life. So regular assessment of students' well-being through surveys, feedbacks, and analyticals helps institution track progress, identify gaps, and refine intervention effectively. So there is a need to call for action. So what are they? University should have a holistic student development. That is, the goal is to create campus where academic learning and mental health support goes hand in hand. Students should graduate not just with knowledge, but with resilience, emotional intelligence, and life skills. And it is a shared responsibility of the university administrators, peer members, and the college professors to make sure it is in supportive atmosphere. There are three concrete steps which we can follow. One is including the educators, then your policymakers and students. So educators can integrate the socio-emotional learning, thereby noticing the early warning signs among students, whereas policymakers can invest in resources, trainings, and infrastructures. And students are those who would engage in peer support programs and promote a culture of openness. So the public health significance of this topic is, so from my public health perspective of lens, I would say education institutions are ideal platform for early intervention and the stigma reduction, thereby community-wide impact. Investing in student well-being is investing in the health of future generation. To move forward, I would strongly recommend that is embedding mental health across the campus's life from classrooms to policies, shift from reactive to proactive systems, that is building resilience earlier, and empower educators and peers, that is to recognize and respond with empathy. So in closing, mental health is not just a medical or psychological issue, but it's the responsibility of education. So our goal should be to create a university that nurture both the heart and the mind. So there is no health without mental health. The key message is that mental health is not an add-on, it is integral to education. So when we improve the mental health of students, it would improve their academic performances, improve their mental well-being, reduces stress among them, and it increase social interaction and better physical health. So these are my references. So let's consider reimagining campuses that not only educate minds, but also heals, empower, and inspire. So this is my contact details, and I'm open for any question and answer.
Thank you, Dr. Indumathi, for your very enlightening research and lecture, and how we can take note how educational institutions play an important role in ensuring mental health among students. So with that, do we have questions for our presenter?
Yes.
Any question? Anyone from the virtual audience? How about anyone from the room?
I have a question. Sorry, I'm just trying to find where to put my hand up here.
Yeah, ma'am.
I'm just interested to know, are there any programs currently in place in the schools in India that are supporting this that you may be aware of?
Sorry, ma'am, can I get back the question? Especially
Yeah.
models at school. Because
Yeah,
this
are
is
there currently programs that are doing this?
yes, this WH, that is NEP of 2020 policies, which says that all your inclusiveness and to reduce, there are so many schools in India which has implemented like breathing techniques, yoga, which is all to reduce their stress. And the NEP policies from 2020, which emphasizes on that. So it is not only your education policies, it also to include their life skills. And
Yeah.
there are schools which has been implementing other things like your agriculture also. So just making them learn day to day like what is to be needed.
Yeah, great. Thank you.
Thank you.
There's some lovely work being done in Australia, but yeah, really nice to hear. It's important work.
Other questions?